Hi, my name is Rochelle Franklin. I'm going to be performing the deep tendon reflex skills video. And first off, I'm going to introduce myself to my patient. Hi, my name is Rochelle Franklin. I'm going to be your nurse today, and I'm going to be performing the deep tendon reflex on you. First, we're going to go ahead and wash our hands, provide privacy, and of course verify with our patient their name and date of birth. All right, so now that that's done, I'm going to explain the deep tendon reflex and why we evaluate it. So deep tendon reflex evaluation is an evaluation of the lower motor neurons and fibers at specific levels of the body. So we have an upper level and a lower level. The deep tendon reflex is important to check in pregnant women as to assess for clonius and hyperactive deep tendon reflexes, which are an indication of hypertension, preeclampsia, and also patients who are receiving magnesium sulfate and electrolyte imbalances can cause some diminish in the deep tendon reflex. We're going to look for something called clonius, which is that hyperreflexation, and that's going to be a muscle spasm that is arrhythmic contractions indicating a neuron condition that affects nerves, causing that muscle movement is what it's controlling, and that's obviously, like we mentioned before, an indication that there may be something wrong, like hypertension, preeclampsia, or an electrolyte imbalance. How we grade the deep tendon reflexes is going to be a 4+, which is a hyperclonius or hyperreflexation, a 3+, which is a brisk hyperreflexation, more than normal, and then a 2+ is going to be normal. A 1+ is going to be a diminished hyporeflexation, and then a 0, of course, is going to be absent. So we're going to start off with our patient's bicep. With that being said, I'm going to grab my hammer. All right, so I'm going to have my patient flex. With checking the bicep, we're checking C5 through C6. And how we're going to check that is we're going to have our patient flex. Go ahead and relax your hand for me. And we're looking in the antecubital fossa while we're flexing the arm, but we're looking for the contractions in the bicep and also flexion in the forearm as well. So we're feeling for a cord-like feeling, and I feel it's about 2 finger widths away from the antecubital fossa, and we're just going to use our hammer and just go ahead and give a light tap. And I did see some flexion in her forearm, and of course we're going to want to support as much as possible for our patient. And then to check the tricep, that's going to be C7 through C8. So with finding this tendon, we're going to have the arm above the elbow hanging. So go ahead and hang like that. And thank you so much. And this is also going to be a cord-like feeling. It's going to be above the elbow, and you'll be seeing an extension of the forearm and a slight contraction of the tricep. So maybe a little kind of movement like that. All right, and of course we're going to be supporting, and I'm just going to go ahead and give it a little tap. Perfect. And I did see a very slight, I would call that a 2+ movement, not too much, not too little, of course. And then for the brachial radial, how we find that is going to be for C5 through C6, of course, and the tendon of the radius, and the styloid process is going to be at the nodule of the wrist, and you're going to be about 2 to 3 centimeters away from that, and feeling for that cord above the hand. And we're going to have her lay her hand kind of on her leg. I'm just going to make sure that you can see this here. Okay, so we're laying it on so that her hand can kind of dangle, and we're looking for that 2 to 3 centimeters, okay? And then we're going to look for the 4 fingers or hand to supinate, so it's going to kind of pop up a little bit, up and out. So, and as you can see, it kind of gently went up. I would call that a 2+ as normal as well. Next up, we're going to go down to the patella. So I'm going to have you dangle your leg for me, and we're going to find the patella first. The patella is going to be L2 through L4, and we're going to have it dangled, but we're going to support the back of the knee while it's dangling, and we're going to see an extension outward of the leg when we check this tendon reflex. Let me just move this a little bit so that you can see a little bit better. All right. And it was slight, not too high or too low. I would call that a 2+. And then last, we're going to do the Achilles, and we're going to move this down just a little bit more. Do you mind backing up so we can see the Achilles? So for the Achilles, it's going to be L5 through L2. You're going to have the patient dangle their foot and dorsiflex, meaning flex upwards towards your face of their foot, and you're going to find the Achilles tendon above the heel, and then we're going to briskly hit it with our hammer. All right, go ahead and relax your foot a little bit now that we found it. And then, of course, we're going to support. Perfect. And looks like she flexed up just slightly. So I would also call that a 2+. And then, of course, we're looking for clonius this whole time, making sure that she's not having any hyper-reflexivity, so that we can indicate this to the provider if need be. Thank you so much for being an awesome patient. Of course, hand hygiene, and we'll go report. Thank you so much. Have a wonderful day.